afternoon. Okay, my name is Dr. Edith, as has been mentioned, and I'm going to present on a study that I did titled Impact of COVID-19 on Essential Medicines in Kenya, an interrupted time series analysis. Next, please. Okay, just to give the context of my study, I did investigate the effect of COVID-19 on the supply, demand, and health-seeking behavior of patients on these medications. And we all know that medicines are essential for management of diseases, and they have been proven to be effective technology against diseases. The emergence of COVID-19 caused a disruption in the global supply chains, leading to stockouts of some of these medicines. And we know that some medicines like ARVs are lifelong, and once patients are started on them, they cannot afford to miss their daily doses. Next. Some of the mitigation measures that were put in place to curb the spread of the virus that included restrictions in movements really impacted on the health-seeking behaviors of these clients. Some hospitals took proactive measures of calling these clients to come pick their refills in anticipation of lockdowns, and also were able to give clients longer periods between refills, depending on the availability of the medicines. Next, please. So, what was the objective of my study? I wanted to investigate the effect of COVID-19 on the demand, the supply of essential medicines for treating malaria, HIV and AIDS, hypertension, diabetes mellitus, and also the patient health-seeking behavior for these medicines at the Bungoma County Referral Hospital. The medicines that I had interest in included artemether-lumefantrine for malaria, tenofovir, lamivudine, and dolutegravir in fixed-dose combinations for HIV and AIDS, hydrochlorothiazide, nifedipine, metformin, and insulin. Next. My study design was interrupted time series, and I used the RIMA method for analysis. I collected data for 49 months from March 2018 to March 2022. And I used March 2020 as the event or the interruption period. That is when COVID-19 was declared a pandemic by the WHO. ARIMA method, I chose ARIMA method because it does control for non-stationarity, autocorrelation, and seasonality. These are features associated with the time series data. Next. These are some of the diagnostics applied to just ensure that the model used was fit for analysis. Next. These are my findings. I did expect that all the medicines, the supply could go down, but here we are. For ARVs, the supply seemed to go up, while the rest for malaria it went down. For nifedipine and for hypertension, the two medicines, it went down, and the rest, I think, it went up a little bit. Next. Then the dispensing rates went down for almost all the medicines, as you can see. Next slide, please. The number of patients went down for all the medicines. Next. Yeah, this is just a graph showing what happened, the results, the supply and demand for ARVs. That is for antimalarials. Yeah, so you can see from the findings that for the supply rate of ARVs seemed to go up, while the dispensing rate and the number of patients went down. Just an interpretation to this, For antiretrovirals, why they went up, the supply seemed to go up because in January 2021, there was a consignment that had been held at the port of Mombasa, I think due to tax disputes, and was released to the market. So maybe that could be the reason why the supply seemed to go up. Then also the number of patients, since the number of patients went down, the supply seemed to be available. The dispensing rates went down because patients were generally keeping off the hospitals for fear of contracting the novel virus. And also the longer scheduling of patients between refills could have also made the dispensing rates go down. The number of patients went down for the obvious reasons, movement restrictions and fear of also contracting the virus. Next. So in conclusion, COVID-19 impacted negatively on the supply and dispensing rates of the medicines that I was studying, and also the health-seeking behaviors of these patients. So going forward, I think hospitals can adapt the proactive measures of maybe calling patients or using drones, such innovations, so that patients cannot miss their daily doses. The medications can be supplied to their comfort or wherever they are. Next. Yeah, so I think I did read for this. Thank you.